This is Crane Durham's Nothing But Truth.
Welcome back, Crane Durham's Nothing But Truth, probably on. Say it with me now. Our talk, and we now jump to the question that was not asked during the press conference today. We'll cover more on that and get your phone calls a little later on this hour on what question you would ask President Obama if you had been in the press room and maybe stole a press pass that said Huffington Post and then they called on you. All right, Crane Durham's Nothing But Truth now welcomes healthcare expert extraordinaire, the man who knows the policies and tells you the truth. He's our truth detector when it comes to healthcare discussion. Avik Roy, Manhattan Institute Senior Fellow. Great to be with you, Avik. Thanks for making time.
Hey, how are you?
Good. Hey, you watched The Daily Show?
I did.
I got to get... Okay. I'm going to play for you a couple clips, and I just wanted to get your response because Kathleen Sebelius, HHS Secretary Kathleen Sebelius, on last night and had some things to say. And Jon Stewart, I think he could be funny sometimes. I think he, it's like I could be offended sometimes. I can be offended at anything, quite frankly. But he's a brilliant guy. And to be funny, you got to be smart. I think that's a part of it. And he did ask some very good questions. He's done some pretty darn good interviews. Now, with this, he's asking about the individual mandate and why businesses get a year extension and individuals do not. It is cut number 5. Roll it.
These are individuals. Now, why is it? I think a very legitimate criticism of this is that businesses were given a delay of a year, but that individuals were not given that option. Why is that?
Well, business owners who have more than 50 employees, and that's the only business owners that have any responsibility, 95% of them are in the market right now. So a delay doesn't change the market numbers. Individuals have tax credits coming their way, have financial help for the first time, and the market that we are now running is available for them.
But would you say that's a legitimate criticism, though, that an individual doesn't get to delay it, but a business does? Is that not legitimate?
I don't, because nothing that helps an individual get health insurance has been delayed at all. They'll get the tax credit this year. They have plans to choose from. And the amazing thing is
so you're doing it because you haven't been able to get the subsidies ready for the businesses?
Well, the
businesses
don't get subsidies. They're just going to exchange.
So they get to delay because they're not going to get any extra money, but individuals don't because they will.
Again, they're in the market already.
Let me ask you this. Am I a stupid man?
Now, she did not answer the question. She was asked actually 3 times. I put together 2 times she was asked. Avik, is there something fundamental to the individual mandate versus the employer mandate that one can be suspended for a year and one cannot?
In terms of the way Obamacare works, absolutely. So in terms of the way Obamacare works, it doesn't necessarily matter whether you get coverage for your employer or from an individual. It might cost a little more if you get it through as an individual because there might be subsidies associated with that, but that's a complicated question. But the point is, if you don't get insurance for your work, you can sign up on the exchanges. It's no big deal from the point of view of the left. What is a big deal, however, is if you don't have to buy insurance, if the government doesn't force you to buy insurance, you're likely not to buy insurance because the whole point of Obamacare is to force young and healthy people to pay a lot more for health insurance so that sick people and older people can be subsidized.
And so they recognize this, obviously, in the way it works, and that could be the part of the resistance to suspend the individual mandate for that year?
That's the entire reason. So why didn't she answer the question? She didn't answer the question because she's on The Daily Show, which is watched by millions of young and healthy people. And she can't give them the honest answer, which is your premiums are going to triple so that we can subsidize other people. She doesn't want to say that. I mean, she doesn't want to say that that's why you need an individual mandate. So that's why she sort of dissembled and kind of evaded the question. Because the truth is that without forcing young and healthy people to pay a lot more for their health insurance, Obamacare doesn't work. According to the government's estimates, which they relied on in designing this law, Obamacare will cover 16 million people less than it would otherwise if there's no individual mandate forcing people to buy coverage.
Part of this, I would play an article, but I'm going to save it for later because I just want to talk to you. Question is, Secretary Sebelius spoke to the idea that now we have a true comparison going back and forth. She was an insurance commissioner, and now the American people actually can compare prices. There's a marketplace. I lost my insurance years back when I was changing employers. And I remember talking to somebody who was counseling me on where to go, an advisor, somebody who was looking for an insurance plan. And I called him, and he said, hey, you can do this, this, and this. And I told him my needs, and then boom. And Kathleen Sebelius, I mean, don't get me wrong, it was expensive, and Cobra is very expensive. But my point is, there was a marketplace before Obamacare, and now she says now there's a real marketplace after Obamacare. What am I missing here, Avik?
Well, there's a couple of things. One, the quote-unquote marketplace, the exchanges under Obamacare are heavily regulated. So the insurance plans have to be designed in a certain way that's dictated by the government. So that makes the plans a lot more expensive, again, particularly for healthy people, particularly for younger people with lower health needs. That's point number one. Point number two, which is kind of a legitimate point, is that it's one thing for you to buy insurance on your own. You can do that today, as you said, on ehealthinsurance.com or any number of places. The difference is that if the government wants to subsidize the cost of that insurance for lower-income people, then you need to have a regulated exchange in order to do that. So, or I should say, you have to have an exchange that's sponsored by the government where you can direct the subsidy. You could also give people a tax credit, but the problem is if you give people a tax credit, then you have to have the government say what kind of insurance is eligible for the tax credit. It ends up being the same thing.
So, bottom line, this has to deal with the government assistance and the dictating of mandating programs have all the bells and whistles into every program. Go ahead.
Now,
Yes.
the one thing that I should mention that's important for your listeners to understand is that nearly everybody in America today gets subsidized health insurance in one way or the other. Obviously, if you're enrolled in a government program like Medicare or Medicaid, that's government-subsidized health insurance. But also, if you get insurance through your work, through your job, that's also subsidized by the government because the way that's set up, the employer-sponsored health insurance, is that it's tax-free to you. So if you get insurance through your work, the value of that insurance in terms of compensation, you don't pay federal income tax on that, you don't pay state income tax on that, you don't pay Social Security tax on that, you don't pay Medicare tax on that, you don't pay payroll tax on that. So you add all that up, it's about $400 billion a year that the government, that in terms of tax revenue, that doesn't go to the government because they don't tax the value of your health insurance plan. So if you have to buy health insurance on your own because you're a freelancer or you work for yourself or you're unemployed, you're the only guy in America who doesn't get a subsidy in one form or another. So there's nothing inherently wrong with trying to equalize that tax treatment. In fact, John McCain's health care plan would have done that, for example. But the problem is the regulations drive up the cost. So when the government forces insurers to do a lot of different things, to help out the sick, to help out the elderly, to add all these benefits to plans that people might not want. For example, every plan under Obamacare has to cover drug addiction, which is great if you're a drug addict, but not if you don't think you're ever going to be a drug addict someday. You know?
And I'm not laughing at drug addiction. I'm just laughing at the fact, well, and that kind of shifts over to the Federal Employees Health Benefits Program. Why didn't they model it more off that? Avik?
Yeah, I mean, there is a bill. I believe Devin Nunes, I want to say, has introduced a bill to do that as an alternative to Obamacare, to use the federal employee health benefits. And for your listeners who might not be aware of how that works, so if you work for the federal government, you basically get to sign up for you get a subsidy. The government subsidizes 75% of the cost of the plan, but you get to go into your particular state and on an exchange that's sponsored by the government, basically shop for whatever plan you want. You just have to pay a quarter of the cost, roughly. And so that's one way to do it. And some conservatives have said that's a great model for reforming the whole system. But Obamacare's exchanges if they had been designed the right way, could have also served that purpose. If they hadn't been so heavily regulated in a kind of a left-wing way, if you actually had the ability on those exchanges to sell, they're now calling it a marketplace because they feel like the exchange term has been poisoned or something like that. But it's not a true marketplace in that the insurer is forced to sell only a certain type of product, a product that you as a consumer might not want. That's why the government has forced you to buy it with the individual mandate. In a real market, you go to the fruit stand at the farmer's market, the farmer sells his oranges, you take a look at them, and if you don't want to buy oranges that day, you look at them and you go home. If you want to buy oranges that day, you buy them. Not so in the Obamacare world where you're forced to buy the orange whether you like them or not, whether they're rotten or not, whether they're fresh or not, right? So that's the thing. So it's not a real market unless people have the opportunity to opt out. It's not a real market if the government is dictating what kind of products are bought and sold.
And that leads us to something we've been covering going back in history before Obamacare, some of the speeches. And I'm not talking about necessarily the promises of lowering the premiums. We've done that before ad nauseum. But the question of people that were uninsured who would cost the system, saying that we're paying for those people anyway, so we need to reform the system. The people that had pre-existing conditions, again, they needed to have access to health insurance. They're being shut out. And so the question goes to, how big were these problems, and what has the evidence revealed, for example, in pre-existing conditions and people signing up for that particular element of Obamacare?
Well, what we know from the data, the economic data, is that the percentage of national health expenditures that's spent on uncompensated care in the emergency room. You care to guess what percentage of it of spending is spent on?
I think, and this is, I always have to recheck the stat, but it's between 2% and 4%. Am I in the area there?
1.79%. So, take Massachusetts. So in Massachusetts, this was the justification for Romneycare, that we got to, require that everyone buy health insurance in order to ensure that these poor hospitals that are suffering don't spend too much on uncompensated care for the uninsured. Well, so yeah, in Massachusetts, spending on uncompensated care for the uninsured went down by $200 million. It didn't go away. It went down by about a third to $200 million a year. But what happened after that? Spending on subsidies and on the Medicaid expansion and the exchange subsidies, all that stuff, was $700 million a year. So yeah, they saved a little money on uncompensated care, but they spent a lot more to subsidize coverage for the uninsured. You know why? Because you don't get drug addiction therapy in the emergency room. You don't get contraception in the emergency room. You don't get all the things that Obamacare forces insurers to cover in the emergency room. Emergency room care is only a small portion of what we spend our health care on, right? When you get your annual checkup every year, that's not in the emergency room. But Obamacare requires every plan to cover all those things. Now, some of those things are good things to have, but it's not being done in the emergency room.
So, as we get through this, we find out that is a reason that we are going to reform the system where we had the vast majority of Americans were getting health insurance and also semi-satisfied with their health insurance, but we needed to reform the market, and the main reason was the uncompensated care and the pre-existing conditions. So, Avik, we've been told that it doesn't work out too well, and then we see what's happened with the exchanges, and I see an article in the Wall Street Journal saying, hey, you know what? Medicare Part D was unpopular at first. So now I see this as a sense of Medicare Part D came in 60% under budget as of 2010, I believe. I'm not sure. You can correct me. You're the man who probably wrote the article. But the bottom line is this. When we hear comparisons now about how things were unpopular in the beginning and they worked out to be successful, do we have a model of that is analogous to Obamacare?
Well, in certain ways, yes. In certain ways, no. So it's true that Medicare Part D has come in under budget because the competition on the Medicare Part D exchanges, that's the Medicare drug benefit, has helped drive costs down. And it's possible that on the exchanges, relative to what the Congressional Budget Office projected we'd spend on the exchange, that something similar happens. That is possible, and there are indications that that might happen. But the difference is that on the exchanges, yeah, federal spending might be lower than expected, but the cost of insurance is going to be higher than what people pay today. And you're being forced to pay for it in a way that you weren't before. So if I'm a relatively healthy person and today I spend $70 a month on insurance, tomorrow I'm going to have to spend $200 a month on insurance. Now, because I have an income that doesn't allow me to get qualified for those subsidies, for federal subsidies, that's a net loss to me. If I'm poor, maybe I benefit from subsidies. But for me personally, Avik Roy, no, I'm going to pay more. Yes, and that's not federal spending, so it's the federal budget isn't affected by that, but my personal budget is, and so that's the difference here. Is that you're going to see a lot of people and people are already getting these notices in the mail where their health insurance is going up. It's particularly bad in states like North Carolina and Nebraska and Arkansas. You're seeing huge increases in the cost of health insurance, and people are not happy about it.
And so that leaves us with the exchanges currently, just coming back to the most pressing story about how many people are signing up, how many people are visiting. They can't answer that, and it's sad and amusing. So, and really, it's overall, it's sad. But my question to you is, do you think we're just seeing a glitch in the beginning of this? And as you just mentioned, the idea of it picking up steam and people getting involved in the individual exchanges, do you believe that this is going to be a 1-month hump when it comes to the glitches in the system, and then we're going to be seeing people sign up for it as they would?
Well, first of all, it's a total lie that they don't know how many people are enrolling in exchanges. They don't want to say. The great thing about computers is the exact number of people who've bought insurance on the exchange. They just don't want to say because it's an embarrassingly low number. The word on the street from the first day of the exchange's operation is that literally under 10 people signed up for insurance on the Obamacare federal exchange because of all the glitches. Now, will the glitches get worked out? I think they will. I mean, I don't know if it's going to take a month. It may take longer than a month. It may take 2 months. But they'll eventually work out the kinks. I mean, this isn't rocket science. It might be rocket science for the Obama administration, but it's not rocket science for the private sector to set up a website where people can sign up for insurance. So I'm sure they'll eventually get it figured out. So I think, look, this is going to be a great system if you're low income. It's going to be a great system if you're really sick today. It's going to be a terrible system if you're not in one of those two groups. If you're relatively healthy or you're relatively young and your income is more than 200% of the federal poverty line, you're going to pay more for your health insurance if you're shopping for coverage on your own. If you're in the employer-sponsored market, it's a different conversation. You'll still pay more, but it won't be as bad in terms of the massive increases that individuals are going to see in the individual market. But, that's going to be the problem. Yeah, the glitches will get worked out on the websites, but the underlying architecture of Obamacare drives up the cost of insurance for most people, and that's not a good thing.
Your prediction, will we have Obamacare as we see it today and its projected form in 2016?
It depends on who's doing the projecting. If it's me, I think Obamacare is going to be more expensive than a lot of people think.
We'll be here to stay,
it's going to be less popular. Okay. I think you look at the Ted Cruz guys who say, who really worry that once Obamacare goes online that it's going to be really popular. And I see that as a defeatist attitude. I actually think, this is the whole thing about this whole shutdown thing, which to me was a terrible, terrible idea. If Republicans had done what they were originally set to do, which is to campaign for a 1-year delay in the law and explain to the voters, look, there's all sorts of reports of problems with getting these exchanges set up, delays and missed deadlines. We need a 1-year delay of this law because it's not ready for prime time. That's what Republicans were prepared to say all summer. And that got drowned out by this whole shutdown defund thing. If they had stuck to that and said that, they would look like geniuses today. Because today they'd be able to say, see, we said that these exchanges weren't ready for prime time, but this law needed to be delayed for a year. We said it, and the Obama administration opposed us. They thought they said we were crazy, right-wing, whatever, and here we are. And why did these Democrats in red states who said to you, you have to have Obamacare, it's going to be so awesome, they were totally wrong, and hold them accountable. And that would have helped Republicans take the Senate in 2014. Because at the end of the day, you can't repeal Obamacare, roll it back, if Republicans don't control the legislature and the White House. And you got to start by taking back the Senate, not by shooting in the foot other Republicans.
Wow. Food for thought, Avik. I'm sitting here going, well, I could debate that for the next hour, but I'm sitting here and going, we've already gone overtime with this man who's been so generous with his time, and I do want to say thank you. Incredible insights, and your expertise is unquestionable. Thank you for taking the time tonight, Avik Roy. Great to be with you.
My pleasure, Crane.
Take care, buddy. All right, that is Avik Roy of the Manhattan Institute, and where he's a senior fellow. If you just type in Avik Roy, we're going to go to break now, but if you just type in Avik Roy and check out all his work, I've posted some of the things that he has put out, but he breaks it down for you. And in breaking down the cost, you see how this impacts certain states as opposed to others. So you hear maybe President Obama say, see, it's lowering premiums on an average of this, but he's being very particular in a particular state. He won't be particular. He'll just say it in a general way, not reference that is actually going up. That said, there are places where you do see premiums going down for a particular group, as Avik mentioned, and that's another, I believe, what is another insidious element of Obamacare is some people will actually benefit, but it will be at the expense of everybody else, and it will be unsustainable. Crane Durham's Nothing But Truth, AFR Talk. Your phone calls on the press conference next, AFR Talk.